This recording is a brief review of chapters 11, 12, and 13. I would recommend that you listen to this several times before you take your test. Before you even worry about this, you need to read the chapters and the summaries at the end of all chapters. All the PowerPoints I've made available to you, everything in this review would be good to learn. And then realize your homework, some questions come from homework, and also if you just did your objective sheets thoroughly, you find everything. So I would study those for sure. The central nervous system consists of the brain and the spinal cord. The peripheral nervous system is all nervous structures outside the central nervous system, things like nerves, receptors, sensory receptors. Okay, now functions of the nervous system. We have sensory or afferent nervous system, takes messages to the central nervous system. Motor or efferent fibers take messages to effectors. Now, this is talking about peripheral nervous system here. So, somatic nervous system is within the body. You're taking messages from the central nervous system out to voluntary muscles. So raising your hand would be an example. Autonomic nervous system goes to involuntary or visceral effectors. It's divided into sympathetic, which is fight or flight, parasympathetic, which is feeding or breeding. Sympathetic response, parasympathetic response, Okay, cells of the nervous system. Neurons are actual nerve cells. They have processes. The incoming processes are dendrites. The outgoing ones are axons. And then, of course, it has a nerve cell body. Neuroglia or glial cells are your accessory cells. They help neurons do the things they do. Astrocytes help control the chemical environment around the neurons. And they also create the blood-brain barrier, keeping things out that don't need to be in the brain. Microglial cells are your macrophages of the brain that eat any kind of trash in the brain that needs to go. Ependymal cells are the lining between the fluid-filled ventricles and the brain proper, central nervous system proper, brain, spinal cord. They fill the subarachnoid spaces around the brain and spinal cord. Oligodendrocytes make myelin in the central nervous system. Schwann cells make myelin in the peripheral nervous system. An action potential is essentially a nervous impulse. It's like very similar to an electrical impulse in a wire going to your computer. It's an all or nothing phenomenon. Either you have one or you don't. Now, a synapse is a junction between two neurons or between a neuron and the effector. Communication between the cells takes place here. Rather than electrical currents being directly transmitted, neurotransmitters are released into the synapse. And this neurotransmitter stimulates an action potential in the neuron. Action potential is actually equivalent to the electrical flow along neurons. Now, the action potential is initiated by a neurotransmitter that's attached to a postsynaptic receptor. Because of this neurotransmitter attaching to the receptor, it allows sodium to enter the cell. Initially, we get graded potentials, which is just localized, and these are going to be directly as a response to the neurotransmitter. Once we get enough sodium enter the cells, therefore enough negativity on the outside of the cell, you will actually get more and more sodium entering because you have voltage-gated sodium channels that respond to the voltage created by the graded potential. And ultimately, you get a wave of depolarization or a negative charge. And it is caused by the entry of positively charged sodium channels entering the cell. So now we say our cell is depolarized. It was polarized to start with. It was polarized because we had a separation of charges across the membrane. After the action potential has peaked, the cell will repolarize itself by allowing potassium ions to go out, and you can get your electrical gradient sorted out, but you can't have another depolarization. It should say a D, not a re. You can't get another depolarization until the sodium-potassium pump normalizes the ion balance of the cell. So it basically picks up sodiums, throws them out of the cell, grabs a few potassiums, sticks them in. One sodium out, two potassiums in. And eventually you have your sodiums on the outside and your potassiums on the inside. So at rest, a neuron inside of the cell has a relatively negative charge and less sodium. This is because you have large anions, which are proteins. They can't get out of the cell. Outside of the cell, more sodium, and it is more positive at rest. Stimulated by a neurotransmitter or voltage potential, sodium goes into the cell, and the outside of the cell becomes relatively negative. And the wave of negativity is your action potential. And the velocity of an action potential depends on several things. The bigger an axon is, the faster the action potential moves, the conduction velocity is. The degree of myelination affects it. The more myelinated, the faster. Acetylcholine at the neuromuscular junction. It is also in the central nervous system. It also affects the heart, gut, several things. Okay, this is a homeostatic imbalance thing that also will be on your test. Sarin gas or nerve gas is an acetylcholinesterase inhibitor. So it prevents acetylcholinesterase from breaking down acetylcholine. It leaves too much acetylcholine at neuromuscular junctions. So victims have muscle spasms, decreased heart rate, increased contraction of other muscles, and they will get death by respiratory paralysis because the muscles spasm out. You will also note that some insecticides will do this same thing. And if faced with treating sarin gas toxicosis or insecticide toxicosis, and you see pinpoint pupils, seizures, I would seriously consider getting atropine, which will block the muscarinic receptors that are causing the patient to die. Okay, norepinephrine, central nervous system, in the central nervous system can inhibit or excite cells. It is a feel-good neurotransmitter. And cocaine, amphetamines, and certain antidepressants increase the amount of norepinephrine at the synapse by preventing its reuptake. And we discussed in class that abuse of cocaine can eventually, actually, that was this one. It can actually burn out your dopamine receptors, which is another feel-good receptor, resulting in Parkinson's disease. Now, most people with Parkinson's disease are not cocaine addicts. However, the Parkinson's disease, the cause is not known. A study came out just this week that relates it possibly to some sort of virus destroying the neurons that make dopamine in the substantia nigra of the brain, substantia nigra of the brain. Okay, serotonin is a feel-good neurotransmitter in the brain. It says causes lack of depression. Basically, lack of serotonin causes depression. And Prozac, Cymbalta, Elavil, and there are many, many drugs that are serotonin uptake inhibitors. Prozac was, or it's also known as fluoxetine, was the first selective serotonin uptake inhibitor. And for just a side note, I put my dog on it this week. Gamma aminobutyric acid, GABA, is an inhibitory neurotransmitter, and alcohol is one thing that causes the release of gamma aminobutyric acid. So think about if you drink a lot of alcohol and your brain is inhibited, it's because of GABA receptors. Endorphins are your natural opiates, and they kill pain. So after exercise, stress, or trauma, you will get an endorphin release, and it helps you feel better. Okay, anatomy of the brain. The cerebral cortex is where your conscious mind is. It's also for motor control. So it's the cortex of the cerebrum. And it's also the executive suite of the nervous system. Gyri, or ridges on the brain. Sulci, or grooves in the brain. Gray matter is nerve cell bodies. White matter in the central nervous system is myelinated tracts. So this is another note. In the central nervous system, we have tracts. White matter is tracts. Peripheral nervous system, myelinated axons bundled together are called nerves. Parts of the brain, we'll just have a few in this review. The frontal lobe is for executive actions, thinking, problem solving, behavior, personality, language. The Broca's area is in the frontal lobe. Also, our motor cortex is for movements, and that is just front of the central sulcus, just anterior to the central sulcus. Sensory is just posterior to the central sulcus, and that is for sensation. Now, the parietal lobe is involved in perception of sensation. Occipital lobe is for vision. Now, you have the actual the very, very back part is for perception, but the visual association area allows you to understand visual stimuli. If you can see something and not know what it is, it requires the visual association area to be working for you to understand it. The temporal lobe is involved in memory, understanding, and language. This is where your Wernicke's area is. People with Wernicke's aphasia, like they've had a stroke in this Wernicke's area, will just talk random nonsense, very much like a typical anatomy teacher, or perhaps even like a math teacher, but they may not be quite that bad. Okay, the cerebellum is towards the posterior of the brain, fine-tunes movement, and the white matter in the cerebellum is referred to as the arbor vitae, tree of life. Cerebral white matter, communication between cerebral cortex and the lower central nervous system. It's also known as corticospinal tracts, pyramids, corticospinal tracts, pyramidal tracts. So if you see the word pyramid, corticospinal tracts, pyramidal tracts, any of that, they're talking about cerebral white matter, taking messages from the brain to lower stuff. Basal nuclei are little small amounts of, they're little small centers of gray matter that are thought to regulate attention and cognition and inhibit unnecessary movement. The thalamus is a center for relaying and editing signals. Nothing is going up or down, around, across that brain without going through the thalamus to be sorted out. Hypothalamus is the visceral control center of the body to control homeostasis. Epithalamus contains the pineal gland, which secretes melatonin that helps you sleep. The pineal gland, and I said that. And the diencephalon includes the hypothalamus, epithalamus, and the pineal gland. The brainstem contains the midbrain, pons, and medulla oblongata. Midbrain is part of the reticular activating system, also filters out things you don't need to know and helps keep you awake. The pons is for communication between different parts of the brain. Medulla oblongata contains respiratory center and cardiovascular centers. The actual cardiovascular centers are important for regulation of heart rate and blood pressure control, but the heart has its own pacemaker, so it will continue to beat without the medulla. The cerebellum is for coordination, and this has already been discussed. The white matter is called the arbor vitae. The limbic system is the emotional system of the brain, and it's located, parts of it in the cerebral hemispheres, brainstem. Most of these are towards the central part of the brain. Now, these are some terms of a few little homeostatic imbalances. A psychosomatic illness is basically a stress-related illness. Part of the brain causes you to have symptoms of illness that may not be physiologically there. However, it's still an illness because it's coming from your brain, but it's still an illness. Hippocampus is important in memory. Narcolepsy is a disorder where you suddenly fall asleep. Insomnia is when you can't sleep, and sleep apnea, you stop breathing during sleep. And this is a very, very dangerous thing because it increases your chance of heart attack, stroke, and death in general. Obviously, narcolepsy is dangerous if you're driving a car. Okay, types of receptors, and I may not have reviewed this before. Nociceptors are pain receptors. Thermoreceptors for temperature. Proprioceptors let you know where your parts are, where your body is in space. Baroreceptors are for pressure, like blood pressure. Chemoreceptors sense chemical changes in the body. Interoceptors monitor internal conditions. Exteroceptors monitor external conditions. Okay, memory. We have initially short-term memory, and it's similar to the RAM on a computer. Temporary storage, such as like you plan on putting things for this test. Long-term memory can be transferred to you can transfer things from the short-term to the long-term memory. And it's stored forever. Emotional state, the more excited you are about learning something, the easier it is to transfer it. Rehearsal, rehearsal, rehearsal. Study, practice, practice. Automatic memory, sometimes you just remember stuff. And then association. You can take a list of words and make up a silly poem, and the poem is easy to remember. And then those words, if you write the little poem out, you could take the first letter of each of those words in the poem or whatever, and remember things better. The little mnemonic devices. Okay, we have two types of amnesia, which again is in the book. I'm not sure I mentioned. Retrograde, you can't remember what happened before. Antegrade, you can't form new memories. This is what happens with Alzheimer's. They can't form new memories suddenly. They know what happened, or they can't retain new memories. They can't transfer to the long-term memory. Okay, traumatic brain injury, concussion, alteration in brain function, following a blow to the head, and often you have loss of consciousness, and repeated concussions are extremely dangerous. A contusion is serious brain damage causes bruising of the brain and permanent traumatic brain injury, or TBI. Subdural or subarachnoid hemorrhage compresses the brain. There's nowhere for it to go. And then the brain will start to swell. You get cerebral edema. So there's fluid building up in the brain cells. If this is not addressed, or even if it is, it can happen, the worst case scenario, the brain swells until the base of the brain starts to squirt out the foramen magnum, and it makes you dead, very dead. Okay, a cerebrovascular accident, also known as a stroke. Now, it can be due to a clot or to bleed. What you're treating. Transient ischemic attacks are generally due to little blood clots, and they will, just be short term. And there are treatments for these. Plasminogen activator, I think is the name of the drug. But you've got to know you're not treating a bleeding stroke, which is from an aneurysm that burst, maybe due to high blood pressure. Okay, sleep. The importance of rapid eye movement sleep. I put these here because this says I am busy. If you don't get enough dreaming sleep, not only will you lose memories, but you will go crazy. See, this cat's scared of that cat because this one is admittedly crazy. So if you don't sleep enough, you're going to go crazy and for your test. It's thought that REM sleep has to do with sorting memories, and therefore you must get enough sleep. The blood-brain barrier, astrocytes are important in forming this. The blood-brain barrier keeps toxins, bacteria, other foreign materials from entering the brain. Of course, glucose, oxygen, alcohol, anesthetics, many other drugs can cross the blood-brain barrier. Okay, specific brain disorders. Alzheimer's, and notice there is no T. There's a T, and there is no T in it. Alzheimer's. No need in arguing with your patients. They're going to call it Alzheimer's, but it is Alzheimer's. Causes memory loss. They can't form whole memories. They remember what they did in 1928, but they don't know what day it is. Neurofibrillary tangles and plaques and brain shrinkage are associated with this. No one really knows what causes it, but things that will make it happen faster. Of course, genetics is a factor, but you also have things such as eating too much rich, high-fat food, smoking, sitting in a chair, doing nothing, drinking alcohol. So basically, sitting there eating greasy food in a chair, watching reality TV, drinking beer, and smoking cigarettes. It's a good way to get it. Parkinson's disease, they have a shuffling gait, trembling, stooped posture, expressionless face, and it's associated with a decrease of dopamine in the substantia nigra. And it is treated with a drug called levodopa. Dopamine won't cross the blood-brain barrier, but levodopa will cross the blood-brain barrier and increase the dopamine available to the Parkinson. Cerebral palsy is caused generally at birth. Bad delivery, they don't have enough oxygen, and they may have anywhere from just maybe one bad leg to severe mental handicap. It can be any degree of it. Anencephaly, the baby has no brain at all. Obviously, these babies will die in short order. Most people, if they find on ultrasound they have a baby without a brain, don't carry it to term, but some do, and they're able to donate organs and save lives, which I think is a very admirable thing. It'd be hard to do. Spina bifida is something I may have forgotten to mention. It is an incomplete formation of the vertebral column, and it's caused by a lack of folic acid or folate in the diet. It can cause anywhere from paralysis severe mental handicap, inability to learn. So it can be a very serious illness, and any female who is sexually active that is of childbearing age and has a uterus at all should take folic acid. I would just take the pregnancy vitamins because accidents happen, and then you don't want to take a chance on losing a baby because time you know you're pregnant, the baby's already formed its brain. Okay, brain waves. Alpha is chilling out. Beta is a little more active. Delta, more common in children. Theta, you're sleeping. I think I got that one right. Lack of brain waves means that you're dead. Okay, spinal reflexes do not require brain participation. You cannot even have a brain and have reflexes. Pulling a hand from a stove is an example. The reflex arc includes a receptor, an afferent nerve, an interneuron, an efferent nerve, and an effector. All this is from, like, say you get burned on a hot stove to spinal cord, and to the muscles that make you pull your hand back. Brain involved. The spinal cord transmits messages from the brain to the body and then back. The gray matter is in the spinal cord contains interneurons, and the dorsal root contains mostly sensory neurons. The ventral root contains motor fibers. And the gray matter, all this is gray matter. This is kind of a weirdly printed up thing, but gray matter in the dorsal aspect is going to be interneurons or sensory neurons. Ventral is motor fibers. Spinal cord white matter contains tracts, myelinated and unmyelinated tracts. Nerves may be sensory, they may be motor, or they may be mixed, both sensor and motory. Spinal cord trauma. Spinal cord damage results in loss of sensation and or motor function below the damage. Depends on which part it's damaged. Ventral root damage, so that's going to be motor. This is spinal cord damage, causes a flaccid paralysis. Think floppy. You get muscle atrophy, you get no movement because you have that ventral root of the spinal cord destroyed. Upper motor neuron damage, motor cortex, is going to cause a spastic paralysis. So the brain may be damaged or dead, and they still have reflexes, but they're not controlled, so they get over reflexes, hyperreflexia. Quadriplegia, all four limbs are paralyzed due to damage in the cervical region. Paraplegia, lower limbs are paralyzed, generally from damage T1 to L1, and damage to the upper cervical spine can cause this, the quadriplegia, but if it's high enough, it's going to cause paralysis of the respiratory muscles. The phrenic nerve will not work and you don't breathe. So flaccid paralysis, lower motor nerve damage, spinal cord. Spastic paralysis, upper motor neuron damage, brain. A few specific nerves, and there's a whole lot more than that. The ulnar nerve is the one we think of as funny bone, and your pinky finger and your ring finger will tingle when you hit that ulnar nerve. Median nerve controls the other three fingers, and it's involved with carpal tunnel disorder or syndrome. Femoral nerve is one you've got to be careful you learn where it is, because you can injure and damage that nerve if you give an improper injection. Sciatic nerve is commonly caused by compression or causes pain in the back, buttocks, or legs. And the compression could be from the spinal cord, sacroiliac, or other places. Okay, cranial nerves, and that's a lot of material on this one thing. I'm going to briefly go through it. Olfactory, cranial nerve 1, smell, sensory only. Optic, sight, so it's sensory only, afferent only. Oculomotor, cranial nerve 3, moves the eyelid and the eyeball and adjusts the pupil and the lens. This is what makes your pupil constrict when you shine a light in your eye. Trochlea moves the eyeballs. There's no sensory here. Trigeminal, facial muscles, chewing, some facial sensations. Abducens, again, just eyeball moving. Facial nerve controls the muscle of facial expression, also taste, tearing, salivating, and Bell's palsy is paralysis of the facial nerve. LS palsy. I can't write very well on the board, and this is really bad. Okay, that'll work. Vestibulocochlear for auditory and balance. I don't know why it doesn't have balance on here, but yeah. A-N-C-E. Now, glossopharyngeal is involved in swallowing, producing saliva and taste. Vagus nerve goes out into the peripheral nervous system. It controls things all through the GI tract. It greatly leaves the brain and controls basically all your liver, lights, chickens, guts, hearts, and parts, and things on your salami can. Or I guess they're not coming cans. Package ingredients. Accessory nerve is involved in moving the head and shoulders and swallowing. And this one actually is a little weird because it starts in the neck and then goes back into the brain. Hypoglossal is for the tongue muscles and speech and swallowing. And I believe that was the last review slide. And I wish you luck on this. And I will give you plenty of notice on when the test is. That's all for now. Thank you.